The basis of integration. What is the fundamental basis for the integration of different systems of medicine? That is what we are going to discuss. All of you are now aware of this 5 layers of existence concept. One fundamental, difference between the modern and the traditional approach is the holistic view that the traditional systems of medicine adopt. In modern medicine, we have body, we had mind also connected to the body, but Descartes brought a split between the two. And there are physicians who do not even believe on the existence of the mind. They say everything is in genes, everything is in the body. So modern medicine is more and more limited to the Annamaya Kosha, the physical layer, whereas there are deeper dimensions of existence, health, and disease according to the traditional systems. Now, this 5-layer concept can become the basis on which the medicine can be integrated. How? There are certain systems of medicine that work at the level of Annamaya Kosha. For example, the modern medicine, there is physical therapy, physiotherapy, there are yogic kriyas, diet, nutrition. All these aspects of medicine can come in the physical layer, the first layer. Then comes the second layer, the pranamaya kosha. The second layer of existence, we see that there are certain branches of medicine, systems of medicine that look into this. Prana also goes very closely with the physiology, So these are energy domains, functional domains. People call it functional medicine also, because you cannot see them physically, but functionally they manifest. For example, the vata, the doshas that we talk in Ayurveda, they are manifested in the form of the physiological functions, as you would have read in the chapter by Dr. Ramasundar from AIMS. So there are several properties manifested in the form of physical and physiological properties that define Vata, Pitta, and Kapha. We can put it as in the Pranamaya Kosha, and also to certain extent in the Annamaya Kosha also, because you can actually see the functional anatomical manifestation of these doshas also. So Ayurveda goes to the Annamaya and Pranamaya. Modern medicine goes into majorly Annamaya. We see diet and nutrition go into Annamaya. And we also see that the other systems of medicine, can anybody tell me any other system of medicine you think that belongs to Pranamaya Kosha, or both Annamaya and Pranamaya? Shri Kirti?
Homeopathy.
Where would you put homeopathy, Shri Kirti?
Since it is related to the energy balance, it would go to the pranamaya and also to the physical existence.
Physical is very less, minuscule,
Yes.
Mainly in the Manomaya and the Pranamaya.
Pranamaya,
Manomaya. It takes a lot of consideration into the psyche.
Pranic healing, Reiki.
Very good. Venjila, very good. Pranic healing and Reiki, which
And chiropractic can be come under this Annamaya?
chiropractic can come into Annamaya, yes. And the
Tai Chi and Qigong in traditional Chinese medicine.
Where would they go?
So they would go in energy, so pranamaya, because it also involves breath work synchronized with movement, sir.
Yes.
And
so So Annamaya and Pranamaya. Major of it is Pranamaya, but it involves some aspect of movements of the body also. So we can put it in Annamaya plus Pranamaya.
I wanted a clarification.
Yes.
What would you really mean by Pranamaya Kosha?
Uh, Good question. Very good question. Anybody from the platform here would like to answer that? There are doctors from naturopathy, yoga also, Ayurveda also. What do you think? What do I mean by pranamaya? Dr. Meena has asked this question.
So the vital force
I'm
for-
not very prone to explain it, but I can say that prana is like how we breathe. Like breathing and respiration is a physiological process. As such, our body is needed that prana energy to carry out this body for the other actions. So that's why it is known as vital life force, vital force. That something is pushing us to do the physical, like physiological process.
Yes. See, I request people to raise hands, then I can call them. Otherwise, there are voices we can't hear properly. Okay, thank you. Thank you. You have suggested that it is connected to life force, it is connected to breath. Shalini ji?
Okay. Pranam, as we know, as per Taittiriya Upanishad, we have 5 koshas. The Pranamaya kosha deals with the Pancha Pranas. This is the energy phase which connects the Manomaya kosha and Annamaya kosha. So this is where, actually, can you repeat the question for me?
What is pranamaya kosha?
What is Pranamaya Kosha?
Okay. So Pranamaya, see, according to Taittiriya Upanishad, we have 5 koshas: Annamaya kosha, Pranamaya kosha, Manomaya kosha, Vijnanamaya kosha, Anandamaya kosha. So the Pranamaya kosha is the one which connects, which is the link between the totally gross Annamaya kosha to the subtle, which is Manomaya kosha. And then this Pranamaya kosha exists in both in the wakeful stage, dream stage, and sleep stage, all the 3 stages.
Very beautifully answered, Dr. Shalini. Okay, so just.
Sorry, I joined late and I was
Yes, no problem, no problem. So here, as Dr. Shalini said, can you imagine a junction between the thought and emotions and the electrical activity in the body? In the body, you see that we have divided the body into different cells, tissues, organ systems. But the functional, fundamental aspect here is the energy, the electrical energy. Everything goes in the form of action potential. So anywhere you put electrode in the body, you can get a current flowing. Now, all of us know that we can use this electricity for diagnosis also. EEG from the brain, and then the ECG for the heart functioning. Even the muscle generates EMG potentials. So if we are able to understand that there are electrical energy that manifests functionally in the body, and there is an emotional energy that generates feelings and thoughts in my mind, you have to imagine a junction between the two, where the emotional energy is connected to the electrical energy. So on one hand, it is connected to the mind, on the other hand, it is connected to the electricity in the body. This is pranic layer. Now, anatomically speaking, like from the yogic point of view speaking, there are 2 ways in which these panchakoshas are presented. One is a graph like I have shown, where the body is the core, and then they understand that the manomaya kosha is within the body everywhere, and it is also expanding a few inches around the body like a sheet of subtle energy. It is there around me also. And then the layer of emotion is more expanded, then layer of Vijnana, and layer of Ananda. So there is a greater and greater expansion. This is one understanding. This, you would have seen this graph other way around also, where the largest layer is the Annamaya, and then inside the Annamaya is the Pranamaya, inside the Pranamaya is the Manomaya, then Vijnana, and then Ananda in the core. So layer within the layer or layer outside the layer. These are the two ways in which these two layers are presented. So before we try to answer the question about Pranamaya Kosha, I would like to ask another question to people here. What do you think, which is correct? Layer within the layer is correct or layer outside the layer is correct? Yes, Chandrakanji.
I think both.
Sir, I think what should be the right one is it should be going inward,
Inwards.
because yoga is all about introspection. It has
Mm.
to go from the external to the innermost. So Annamaya Kosha, according to me, should be at the top level and then coming inwards.
Wonderful. Those who agree with Dr. Chandrakant, just raise your hand so that I come to know that, okay, these many people are there who are agreeing with what Dr. Chandrakant said. Yes. 6, 7, 8, 9, 10. Yes. But still majority is silent. Okay. And how many people, now you can lower the hands and let me just ask, how many people agree with what is shown here? That layer is outside the layer. Just raise your hand now. Megha, Basmila, Abhinaya, Drishti, Khushbu, Shalini ji, Diksha, Veena, Anju, Priyadarshini. More and more people are raising hand for this. Sritej, Bhupati. Okay. So I see more people have responded to this kind of a presentation where they are more and more expanded. So this looks really, opposite. But as Dr. Shalini was saying, I would like to draw your attention to this particular phenomena in the traditional systems of medicine, especially the yogic medicine, where the two contrasting opposites can coexist. In our Upanishads, there is a saying, Anor Aniyan Mahato Mahiyan. It means it is bigger than the biggest and smaller than the smallest at the same time. At the same time, it is moving as well as not moving. So at the same time, it is moving outward also and inward also. So therefore, the correct understanding is that both happen simultaneously. Both things happen simultaneously for the Panchakosha. They keep on expanding also, and they also keep on becoming subtler and subtler. They also keep on becoming subtler and subtler. I hope you are able to imagine that something going within itself becoming subtle and subtle, but at the same time also expanding. This is how these panchakoshas are connected to each other, and this is how you have to imagine the pranic layer. The ancient text says that chale vate chale chittam nischale nischalam bhavet. As the breath moves, the prana moves. As the prana moves, the thought in the mind moves. And also, wherever you put your attention in the body, there the prana starts flowing more. So, for you to feel prana properly, we can do a very small exercise. You would have done this in your childhood also. Just bring your hands together and start rotating them. Just rotate clockwise, everybody. Start rotating your hands, students. Just rotate clockwise. Now go reverse. Do anti-clockwise. Again clockwise. Your hands are rubbing against each other. Now close your eyes and continue this movement. And now, marginally, just separate your hands that much that they are just about to touch, but they are not touching. Just about to touch, but they are not touching. Now continue this cyclical movement forward and do it reverse. Can you feel a smooth plate, a very smooth energy shield, which is moving between your hands, which is preventing your hands from joining, but also facilitating a smooth, it is acting as if it is a lubricant between your two hands, going cyclical forward and backward. Could you feel it? I request people to please share how many of you could feel something there between the hands, which cannot be seen but exists. Softness, yes, softness, energy, which doesn't allow the hands to touch, but it exists. How evidently you can feel something there. Especially Dr. Meena, could you feel it?
Yes, sir.
Yes. Softness and warmth, energy, everybody, almost everybody is able to feel that. I request people after talking, please mute. It produces some background noise here. Okay. That's good. That's good that all of you were able to feel it. Now, this energy is subtle. It is within also and it is around also. So, both ways, these panchakoshas are related. Now, we come back. Yes, magnetic smoothness is probably the best word to describe it. Magnetic smoothness. This is the nature of your prana. Now, it will be very interesting to discuss, how you can channelize this pranic energy towards healing. And how does, yoga philosophy also understand this? So the Tai Chi and all energy aspect, the pranayamas, all belong to the pranamaya kosha, regulation of the breath.
Dr. Hemant,
Yes.
before you continue, I would like to clarify that though allopathy is directed at Annamaya Kosha, the doctor behind allopathy works at Pranamaya Kosha and Manomaya Kosha to facilitate the Vijnanamaya Kosha and the Anandamaya Kosha in the patient.
I agree with you, madam. They do that, but they are not aware of it. They are not, this is not structurally taught in the modern medicine, whereas in the yogic literature or the traditional literature, these layers are very clearly identified. And that is why these traditional systems of medicine are able to harness them and use the applied aspect of this knowledge much better than the modern medicine. It
In the
happens.
modern medicine, it's called placebo effect.
Yeah, I mean, this is a negative
But
thing, no?
the strength behind it is the power of the doctor who is treating it.
Yes,
How pure are the intentions?
I agree with
How
you.
compassionate is the doctor?
Yeah, I completely agree with you. It is definitely, especially, the family physicians who were much more oriented to the holistic aspect of the treatment. And this concept was very much there. If you look at Hippocrates, when he used this humors to actually consider all these aspects. But then after Descartes, mind and body were split. And then there was no, I am not saying that going towards the body is wrong. Definitely, there are a lot of advantages and miracles of modern medicine, especially, managing the deadly diseases which were major killers the infectious diseases. But now the need of the hour is that we use this available knowledge base more effectively together with the modern medicine, so that there are best possible outcomes for the patients. Now, modern medicine calls it placebo, but that carries a kind of a negative thing with it, whereas in traditional systems they are given a positive name like prana, like energy, like dosha, so that they are able to apply it, they are able to manipulate it, they are able to use these dimensions also in treatment. It is very much there in the Unani medicine also. They use similar three kind of a humor there. It is there in Sova Rigpa also, where they call it lung, kripa and beacon, which is vata, pitta, kapha. These are there in homeopathy also. And you see this system also is there in naturopathy and siddha. So the message that I want to give here is that this is very, very structured in the traditional systems and in siddha medicine also. So with this kind of a understanding, we can integrate different systems of medicine if our objective is to bring a harmony and balance in all the five layers, in all the five layers of existence. Now, how can we bring a harmony and balance at these five layers of existence when we are using different systems of medicine? First, we have to understand the fundamental concept. See, this is about which layer is affected by which system of medicine. The pathophysiology of the illness also differs. In modern medicine, the causation, is either in the body or it is idiopathic. Correct? Whereas in the traditional systems, the etiology of the disease also goes across these layers. For example, you would have read in the first chapter, Yoga Vasishta says that there are two kinds of illnesses. One, both manifest on the body. When an illness manifests on the body, it is called as Vyadhi. Now, this Vyadhi on the body can come from two directions. One, it comes from outside, that is known as Anadhija Vyadhi. This is poisoning, snake bite, infections, burns, accidents. There is another way in which Adhik can come. And Yoga Vasishta is very clear about it. Yoga Vasishta says that if there is no cause outside, you have to automatically assume that the cause is inside. Means it is very clear, it says that every disease has a cause. It is not possible that something exists without a cause. So there is nothing called as idiopathic in traditional systems. Traditional systems can provide explanation to everything. They can give a pathophysiology for any disorder that exists. And that is called as samprapti in Ayurveda. And there are these multitudes of diagnoses are not there. The understanding is quite clear and quite simple that if the cause is from outside, then the solution also can come from outside. So modern medicine was very successful when the cause was from outside, or when the cause is from outside. In accidents, emergencies, it is life-saving. When you look at infectious diseases, it has eradicated so many infectious diseases. Then when you look at poisonings, there are antidotes for all major poisonings. If you bring the patient in time, his life can literally be saved. This is a boon. But what is the error that modern medicine did? Modern medicine started applying the same formula that it applied for a disease which has an external cause to the diseases which had no external cause, but an internal cause. Therefore, surgery doesn't cure diabetes. No medicine is able to cure diabetes, or you say hypertension, or hypothyroidism, or different kinds of cancers. Again and again, they recover after radio and chemotherapy. Or you look at migraine, epilepsy, autoimmune disorders, obesity, all major NCDs, heart diseases, lung diseases. So the understanding here is the time has come that we look beyond the Annamaya Kosha and understand the dynamics of the energies, the emotions playing within an individual, and use them also, as active tools to bring harmony into these layers of existence. So in integrative medicine, the definition of health is harmony in all the 5 layers of existence. That is called as health, and not merely an absence of disease. So when we understand that, then we see that, okay, my major problem is not anadhija vyadhi now. The diseases which have an external cause, humanity is able to manage them quite well. Our major problems are diseases which do not have a pinpoint external cause. You cannot give a pinpoint antidote. One pill will not solve the problem. But what we do, millions of dollars are spent every year to find out a miraculous molecule which can help you weight loss. Now, Ozempic is a big thing in US now. Everybody is just taking a pill and trying to lose weight. But I can tell you, the problem has come from deeper layers. As long as you take medicine, you will be able to suppress it. After that, it will come back, or the imbalance in the energy will manifest in some other way, bringing side effects or major problems. So this mindset that one pill can solve all the problems, we should be able to give away with this mindset and should be able to focus on bringing a harmony in all these 5 layers of existence by using different systems of medicine that work on those levels. So CBT, psychotherapy, these systems work in Manomaya Kosha. And now we see that trend is happening, but they don't understand the interrelationship between it. There are, people who have these kind of NCDs, they also undergo psychotherapy. But the psychotherapist doesn't talk to the physician here or to the endocrinologist. The endocrinologist doesn't talk to the psychotherapist. They both deal in silos independently, as if they are dealing with 2 different individuals, 2 different problems. But here, our traditional understanding says that all these problems are completely intertwined and interconnected with each other, and we need to have a holistic, broad perspective to treat these non-communicable diseases. If you look at the traditional text Yoga Vasishtha, it very clearly says for an illness caused due to outside cause, adhija vyadhi, the treatment is shalya aushadhi mantra. It says that you can do surgery, you can do aushadhi, means you can use the herbs that are there around. They are for such kind of problems only. And the third it says is mantra. There are specific mantras that are used. Even in Ayurveda, there is a mention of such mantras used for snake bite, scorpion bite. I have myself seen in villages people relieving these kind of problems or pain by chanting mantras. So mantra, aushadhi and shalya works for anadhija vyadhi. Now, when it comes to adhija vyadhi, the illnesses that are not having an external cause but an internal cause, the treatment that Yoga Vasishtha provides is known as prati prasava. Prasava means delivery. Prati prasava is reverse delivery. The model says that the individual himself has delivered the disease like an individual delivers a baby. How he has delivered? The seed of that disease was created in the Manomaya Kosha. Then it grew further, it became heavy, created that imbalance, it percolated down into the Pranamaya Kosha, brought an imbalance in the prana. In fact, what exercise I gave you on the hand, there are meditators who can channelize the prana on different layers of the body and actually can feel that there are certain parts of the body where they cannot move their prana, where it is stuck. This happens way before the disease develops, months or years before. And then from the Pranamaya Kosha, it brings imbalances into the genetic expressions, epigenetic changes, electrophysiological changes. Then comes the changes in the neurotransmitters and hormones. Then comes the functional changes in physiological functions, and then later, way much later, the disease manifests itself or takes birth in the form of a observable organic cause into the system. Okay, and that way traditional systems of medicine feel that the diagnosis according to these ways is much later than the disease has caused, but it could have been reversed or prevented way earlier if there was a sensitivity, there was a knowledge about how disease manifests from the traditional treatments. So to understand that, the prati prasava to happen for the way the disease has taken birth, the traditional system says that in the same way, the imbalance from the Annamaya Kosha can go back to prana, from the prana back to Manomaya in the emotion, and then it can be diffused into inner Ananda, into Vijnana Anandamaya Kosha. The imbalance can be diffused and dissolved. So the green and the blue layer, the Vijnana and Ananda, are always healthy and always perfect. And the whole effort of the health is to bring such harmony in the initial three layers that the individual is able to touch his own Vijnana Anandamaya. And that itself has a harmonizing effect. That touch to the deeper layers itself has a harmonizing effect and bringing a balance into these layers. Now, this exposure to this Vijnana and Ananda is achieved at the Manomaya Kosha level by psychotherapy, by yogic insights, by self-awareness, by mindfulness. That exposure is achieved at the level of prana by acupuncture, energy medicines. The same thing, that harmony is achieved by giving externally the hormones, the medicines, or to manage diseases, or giving antibiotics at the Annamaya. Ultimately, the whole effort is bringing a harmony and balance rather than blocking things without looking at the deeper aspects of the individual. So, what is the basis? What is the basis of integrative medicine? You can see here, there are 5 basic elements that predominantly exist, that are there in the body everywhere, that are there in the environment everywhere. Is there any system of medicine which is not involving one or the other of these 5 basic elements? Is there any disease which is not involving one or the other of these 5 basic elements? So this is the platform on which the medicine can get integrated. On the y-axis lies the 5 basic elements. They need balance and harmony. And this is on the x-axis, and on the y-axis lies the 3 layers which need balance: Annamaya, Pranamaya, and Manomaya. So if we are able to bring about this kind of an understanding and balance to an individual, then we should be able to move towards a smoother integration. Some examples that I would like to give here, we see patients who have multiple sclerosis are admitted in our wards. These MS patients show acute exacerbation of inflammation. And when that happens, then they are prescribed steroids. They also undergo panchakarma. They also do pranayama in our ward here. Now, the understanding according to modern medicine is that it is an autoimmune disease. The immune system has developed an imbalance between self and non-self. And otherwise, why that happens, we don't know. And then there should be, the treatment is anti-inflammatory agents, immunoglobulins, which can suppress this kind of inflammation that is going on. Now, this is, according to Ayurveda, the acute exacerbation of inflammation is a manifestation of Pitta. So, Pitta and Vata Prakopa is happening. Now, Ayurveda sees steroid injection also as a Pitta Shamaka. Now in Ayurveda also the treatment is done in two ways. One is pacifying the dosha, which is known as Shamana. And then from the core removing that dosha, which is known as Shodhana. So we use cooling pranayamas, relaxing pranayamas. Yoga is also anti-inflammatory. Number of researchers now show, recent meta-analysis showed that yoga reduces CRP levels. So pranayama and meditation, cooling pranayamas, relaxing pranayamas. Shamana, that is taking place through steroids in the acute phase. From the Ayurveda point of view, Pitta Shamana, Aushadhis that can reduce the Pitta and Vata, Madhura group of Aushadhis, or if required, patient after little bit stabilization undergoes a Virechana procedure, therapeutic purgation to remove the Pitta dosha from the system. We also look at the particular frame of mind. MS patients especially are perfectionist in nature. They are highly sensitive. They demonstrate, we have done there, repeatedly patients keep coming. So the kind of mental framework that we see is Rajo Sattva. So ability to relax and let go at the Manomaya Kosha, listening to them, talking to them, resolving deep emotional conflicts. So we work at the Manomaya, we work at the Pranamaya. Acupuncture also can be used if there are specific points where there is more pain. In Annamaya, also Pitta reducing diet. There are diet for Vata, Pitta and Kapha. And modern medicine gets integrated into that as a Pitta Shamana. But that doesn't become the mainstay of the treatment, only during the acute point of view. But then the holistic way of managing the lifestyle here becomes very important. There are pranic energization technique, which works wonderfully in multiple sclerosis, because here the prana that is affected is Vyana prana. The prana that circulates throughout the body is affected, which physiologically or anatomically manifests as the loss of myelin sheath. So the prana flow has to become proper. There is actually a pranic energization technique that begins with rubbing of the hand and then meditation and running it around. That is a very key practice in MS. We have done studies in Germany. There are publications. So dear friends, this class, I want you to please have a look at this very, very fundamental understanding of integrative medicine that we want to impart. This is the slide on which all of us can coexist in harmony. All of us can apply our medicine in harmony, and all of us can bring well-being to our patient in all the dimensions of existence. So I request all of you to pay attention to it and keep this slide in your mind throughout the course. When we discuss a case, when we have people coming on this platform and sharing their views, please see that in our mind, fundamentally, we are looking at this. Okay, now we had some interesting questions that came up today. What is the relationship? What is the relationship between this Vata, Pitta, Kapha with Sattva, Rajas and Tamas? How are gunas and doshas connected to each other? So I would like to first hear the views of the people who are there. Please let me know, what do you think? How are the doshas and the gunas correlated? You can just raise your hand, I'll ask. Yes, Meena ji.
They are to be explained as something which is related to the Manomaya Kosha and above for the Rajas, Tamas and the Sattvic.
Yes.
And for the Annamaya Kosha, they are the reflections like Vata, Pitta, and Kapha.
And how
So
they
you would say
correlate
that,
with each other?
yeah, I'm going to say, you would say that a person with a balanced doshas falls more into the sattvic and is mainly of pitta type with a balanced doshas. And the vata person is the one who is moving, that is rajas. And the kapha is the structure which is balanced, looks more towards inertia, but not completely divisible. But these are the main directions which we could say are there.
Yes, yes, yes.